My name is Oliver Grimm, and I'm the chairman at the Department of Urology at the University Hospital of Jena. The Nimbus trial compared two different schedules of BCG in high-grade non-muscle invasive bladder cancer. And the one schedule was the standard frequency, once weekly instillations in week 1 to 6 for induction and weeks 1 to 3 at months 3, 6 and 12 for maintenance. And we compared that with a reduced frequency arm, which consists of 9 compared to the standard 15 instillations, with an induction cycle in week 1, 2 and 6 and maintenance in weeks 1 and 3 again at months 3, 6 and 12. And the data presented here was from a safety analysis. And this safety analysis led to premature closure of the trial because we saw that the time to first recurrence was significantly inferior for the reduced frequency arm compared to the standard arm. BCG is usually affected with considerable side effects for the patients. A lot of patients discontinue the treatment, and we wanted to reduce the symptom burden associated with BCG. So reduced frequency means less inconvenience, probably less adverse events, and also less cost. And it would maybe also could have helped to solve the BCG shortage problem. Yeah, this has been already tested in another trial by the EORTC, and they compared a third of the regular dose to full dose. This was a 4-arm trial actually, with the third dose for 1 year and 3 years, and this was compared to full dose 1 year and 3 years. And this was again a non-inferiority trial, and it showed that 1 year with 1/3 of the dose is suboptimal and should not be used. Actually, we had a very low recurrence rate in the standard frequency arm of Nimbus, and we try to analyze this in more detail. This will be shown at the upcoming EAU conference, the results of this post-hoc analysis. We think it's due to the use of the routine re-TUR. So patients underwent a TUR, the diagnosis of the high-grade cancer was found, and then the patients underwent a second TUR to confirm that there was no residual tumor. Because BCG is not a treatment, it's a prophylaxis for recurrence. And the recurrence rate at 12 and 15 months in the standard frequency arm was 11 and 15%, so very low compared to all other studies we have seen. And we think it's attributable to the use of routine re-TUR. And I think this study even sets a new standard because the recurrence rate is so low. At the beginning it was a little bit tough because we had difficulties to set up the other countries. The study was conducted in 51 sites in 5 European countries, and the other countries besides Germany and the Netherlands came in very late. But in the end it was a very fruitful collaboration, especially with Wim and Christine Karis, who is the statistician. Was very helpful, very good collaboration when we analyzed the data. Very quick answers, very good correspondence, excellent.